brainstem, the midbrain, pons, or medulla. In fact, the only ones that really don't come from the brainstem are the ones known as cranial nerve number 2, the optic nerve. Is it yeah, I did. Yeah, I did. Yep. I've mentioned strokes a number of times, the CVAs, but I did skip it. So that's the cranial nerves. That's why they're referred to as the cranial nerves. And that's, what we're going to see by comparison with the spinal nerves. The cranial nerves take a little bit more time and energy to memorize. Yeah, they take a little bit more energy to memorize because what we're going to see with the spinal nerves is they just have numbers. It's cervical number 2, cervical 3, cervical 4. Cranial nerves, all 12 pairs, have numbers and names, and the numbers are Roman numerals, and I know some students find that to be a little confusing, and the names that describe the function can be confusing. The main thing to remember about all of them is most of them have some kind of control over the head and neck region. Most of them had control over the head and neck. Not all of them. There's one pair of cranial nerves that actually leaves the head and neck. We'll talk about them. And some of these are not purely sensory or purely motor. Some of them are combinations of sensory and motor. So the whole list is on page 164 and kind of at the top of 165. And I just kind of made this great huge table. And this partially comes from when I would teach it in class face to face, and I would go through it sort of step by step. So I'm gonna do the same thing, but you guys can see everything all out here all at one time. I used to do it just sort of one row at a time. But I think that it is important, as mentioned at the top of page 164 in your lecture notes. I think it is important. I agree completely that it is important to learn some kind of mnemonic, which is a memory aid, a mnemonic device for memorizing the names in order. And that's because these are from anterior to posterior of the brain. So the most anterior pair are the olfactory nerves. The most posterior pair that come off of the medulla oblongata are called the hypoglossal nerves. So I think it's important to have some system for memorizing those. We've got one at the very top, O, to touch and feel very good velvet, ah. And the ah at the end is accessory and hypoglossal, the AH. I always encourage students to make up one of their own. There's also, let me mention this little website. I haven't mentioned it before. You guys may have heard of it. It was started by nurses a couple of decades ago when websites were still kind of a new thing and not everybody had them all over the place. So this is like the late 1990s. Just Google medical mnemonics. The M on that second word is silent, but that's the word for memory. Medical mnemonics, and it'll probably be the first hit that you get. I think it's medicalmnemonics.org or medicalmnemonics.com. I don't know, but it's one of the originals started by nurses and nursing students. Some MD students and PA students have contributed, but it's all kinds of helpful memory aids for all sorts of things from A&P 1 all the way through nursing school. All the classes all the way through. And you'll find tons of them for the cranial nerves. And I'll tell you why. I'm trying not to over-dramatize this too much. There is no job in healthcare that I can think of. No job that's direct health care of patients that you do not need to know the cranial nerves. That includes physical therapists, sports trainers. You think, I don't really need to know this because I'm doing respiratory therapy assistant. Yeah, you do. Everybody that has some kind of contact with patients or clients in a health related field needs to know the cranial nerves. Everybody does, because they are critical. They are absolutely a key part of the physical assessment. One of the first things that you'll do with patients, taking a history and physical assessment. Okay? So these are them in order. They also have Roman numerals. So cranial nerve number 1, cranial nerve number 2, and so on. Okay? The first one is called olfactory, and it only is sensory, and it's the sense of smell. The second one is called the optic nerve, only sensory, and it does vision. So you can see I've got sensory, and I only put the function under sensory. So these have no motor function. They don't have any axons that are output or efferent fibers in these nerves that we need to worry about. The honest truth is that some of them do, but we're going to focus on just their sensory function. We're going to look at these optic nerves in more detail, pardon the pun. We're going to look at these optic nerves in more detail in a couple of chapters when we talk about the eye and vision. So there are some details under Roman numeral 2 in the middle of page 164. I'm going to leave it for now because we will come back to it. But suffice to say, that stuff about optic nerves, optic chiasma, and optic tract, we will talk about again. It'll be in bold in a future chapter. I think it's in chapter 17. Way on down the line in a couple of weeks. 3 weeks, I think. Cranial nerve number 3. Now, cranial nerve number 3 its name gives us a little hint. It's not sensory, it's motor. And oculo means eye motor. It moves the eye. So you can see it's motor there. Doesn't really have a sensory function that we need to worry about. And again, when we talk about the eye itself, we'll talk about the 6 muscles that move your eyeball around. 4 of those 6 muscles are controlled by the oculomotor nerve. These are called extrinsic eye muscles. There are also muscles inside the eye that control the size of your pupil and control the shape of your lens for focusing. All of those are controlled by fibers in cranial nerve number 3. So when you are inside and you step outside on a bright sunny day like today, at least it is here where I am, beautiful bright sunny day, your pupils will constrict because of muscles that are in the pigmented part of your eye called the iris. So if you have brown eyes or blue eyes or green eyes, there's some melanin in there, and hiding behind that melanin are smooth muscles that constrict. The pupil is just the hole, but that can constrict to reduce the amount of light coming through, and that's all controlled by that oculomotor nerve. Okay? There is cranial nerve number 4 called the trochlear nerve. That trochlear nerve is also motor only, and it controls, let's see, if this one up here, oculomotor, controls 4 of the 6. This one's number 5 of those 6, because this is a muscle that moves the eye as well. And then I'm going to skip down here. This is cranial nerve number 6. It's also motor, and it controls another of those 6 muscles that move the eye. So eye movement, cranial nerve 3, 4, and 6. Cranial nerve 3, 4, and 6. Cranial nerve 4 only controls one of the muscles called superior oblique. Cranial nerve number 6 only controls one of those muscles called lateral rectus. The other 4, like I said, we will learn in a few weeks when we study the movement of the eye itself. Okay? So 3 whole cranial nerves entirely focused on just moving the eye. 1 cranial nerve for vision from the eye. That's cranial nerve number 2, the optic nerve. So we already have, of all 12 cranial nerves, we've got 4 of those cranial nerves that are related to the eye in some way. Cranial nerve number 2, sensory from the eye. Cranial nerve 3, 4, and 6, motor to the muscles that move the eye. Okay? Now, let's get to some of the more complicated ones. Trigeminal and facial. Trigeminal, cranial nerve number 5, and you can see why I called it a little more complicated, because it's not only sensory or motor like the ones we've been talking about so far. It's both. It's a mixed nerve. It's got some sensory function, which is the sense of touch or pain on the face. So if you touch your cheeks or you touch the outside of your jaw or you touch your forehead, that's trigeminal nerve. But there are also motor fibers that go to these 2 muscles, and a few others, in fact, the masseter and the temporalis. Let's see if they're listed. Nope, just masseter. Not even temporalis. Not even the pterygoids. These are muscles that are known as the muscles. I gotta spell it really carefully. The muscles of mastication. Muscles of mastication. What is mastication? What is mastication? Yeah, chewing. So even though masseter muscle is the only one listed in your notes, the temporalis muscle is another muscle that you've learned about, or you are learning about in lab, that closes the jaw, and it also is controlled by the trigeminal nerve. Okay. All right. Then we already mentioned abducens. Facial, cranial nerve number 7. It's another one of the little complicated ones because it's a both. All right. And it also has sensory function. But I got to tell you this, guys. This confuses people all the time. So I'm trying to make a big deal out of it. Is everybody listening? I'm gonna put another little red flag because it's just going to come up. Red flag. Little red flag. Okay? It's called the facial nerve because of its motor function. It controls the muscles of facial expression, the muscles that move your face, like orbicularis oculi and orbicularis oris and zygomaticus, those muscles that we talked about on that last exam that insert into the skin of the face and control the skin of the face. That's why it's called the facial nerve. You know what's going to be confusing? You will be asked which cranial nerve is responsible for the sense of touch on the face, and some people will put facial nerve. The facial nerve is named for its motor function, not its sensory function. Got it? I'm trying to make a big deal out of this on your behalf. Well, the correct answer to the question that I just asked, yes. What cranial nerve is responsible for the sense of touch on the face? It's the trigeminal nerve, yes. But because the question has the word face in it, some students that just don't know will guess face. I mean, they'll guess facial nerve. And it's just not right. And I feel like every year, every semester that I teach this, if I make a big enough deal out of it, fewer and fewer people will miss that question because it always comes up. It's always showing up. I feel like sometimes there are those out there, not me, that always put these questions on the exams because they know they're gonna catch you. So big old red flag, everybody. I'm waving the red flag. There it is. It's waving. What cranial nerve is responsible for the sense of touch on the face? Not facial. Trigeminal. What is the facial responsible for? The facial nerve is responsible for muscles of facial expression. It also controls your lacrimal glands. There's another thing related to your eyes. Let's put an eyeball right there. That's creepy. Okay, so there's another cranial nerve that has something to do with your eyes. Lacrimal glands produce tears. And salivary glands, that I think everybody knows, they produce saliva. That's all controlled by the facial nerve. What is the facial nerve's one sensory function? Sense of taste. Sense of taste on the tongue. And it doesn't even do it by itself. You can see it shares that sense with two other cranial nerves. So the sense of taste on your tongue is shared by three separate nerves. Okay? These are things that are great things to organize on a note card or on a set of note cards. Have one note card for the sense of taste. What cranial nerves? And then flip it over. Facial, glossopharyngeal, vagus. One note card that's like, name all cranial nerves that have anything to do with the eye. Cranial nerve number 2, optic, oculomotor, trochlear, abducens, and facial, because the lacrimal glands secreting tears on the eyes. Oh, and trigeminal, the sense of touch. Check this out. Let's see. This is going to erase all my little red flags, but I'm going to do this again. I'm going to share my camera again. Okay? Because this is the way that we test the cranial nerves in a clinical setting. All right. So when you're testing the trigeminal nerve, you just kind of touch the patient and say, does this feel the same? Does this feel? Because you have two trigeminal nerves, left and right. Okay. So you go, does this feel the same? Does this feel the same? Does this feel the same? Does that feel the same? Does this feel the same? Does that feel the same? You got the trigeminal nerve is named trigeminal because it has 3 divisions. So it's got a division that goes across your forehead, a division that goes across your cheekbones, and a division that goes down your mandible. But here's the thing. It also does surfaces in the region as well. So you can test the trigeminal nerve also. I don't have any handy, but they used to, we don't usually do this too much anymore, but you can use a little bit of a cotton ball, not a Q-tip. Don't stick a Q-tip in your patient's eye. But you can take a little bit of a cotton ball, pull a little bit of the cotton away, and just use it to, and you can do it with your finger too, just gently touch the eyelashes, and they should obviously blink. That's trigeminal. Even the surface of the eye, if you get some dust or dirt on your eye and it hurts really bad, that's trigeminal also. The surface of the nose, the insides of the nostrils, that tickly feeling when you got to sneeze, also trigeminal. The sense of sensation in your teeth, also trigeminal. The trigeminal nerve is the one that you deaden with Novocaine when the dentist needs to do dental work on your teeth. So it's not just on the surface of the face, it's also your teeth and the surface of your tongue. When you bite your tongue by accident and it hurts, that's trigeminal as well. So the trigeminal nerve is not only on the surface of the face, it's also the sense of touch in some of those interior places as well. Okay, so trigeminal nerve is big. It is in fact the largest. It is by far the largest cranial nerve, the trigeminal. It's got a lot going on. It looks like it's simple. We don't have a lot of functions listed for it because we're trying to make it manageable for you to learn. But at the next level in nursing school, when you learn about these again, you're going to be like, man, that trigeminal, it covers a lot of territory, and it really does. Do not get it confused with cranial nerve number 7, the facial nerve. Its only sensory function is its shared sensory function of taste. Okay? What about pain on the tongue? Trigeminal. Taste on the tongue, facial, glossopharyngeal. Vagus is actually taste in the throat, which is your oropharynx, that area, that space in the back of your throat. Taste on the tongue is facial and glossopharyngeal. I never know how to spell tongue. I always misspell tongue. If you ever misspell words, you know I feel you. I have to work on spelling myself. Vestibulocochlear, cranial nerve number 8. It is pretty much sensory only, the sense of hearing, as well as the sense of balance and equilibrium. Remember, we just talked about a lot of this info is going to go to the cerebellum. And these nerves come through the ears. They come from the ears. More on those when we talk about the ear itself. But infections in the ear can cause you to feel dizzy or out of balance, a condition that we sometimes call vertigo. A lot of different things can cause vertigo, but a middle or inner ear infection could affect the balance because that's where these nerves come from and communicate to the cerebellum. Glossopharyngeal is mostly taste on the surface of the tongue, but also controls some of the muscles involved in swallowing. No specific muscles you need to know, just muscles of the back of your throat behind that little dangly thing in the back of your mouth called your uvula. Like if you stick your tongue out, let's draw a tongue here sticking out right there. And this whole space, I'll shade it in back there behind all of that. That's the area called your pharynx. And there are muscles back there involved in swallowing and moving food down to the esophagus. That's what the glossopharyngeal does, as well as taste on the back part of the tongue. And glossopharyngeal has some control over your salivary glands, which it shares with the facial nerve. Okay, so again, all of this stuff is going to look really confusing, but you can sort it out by putting different combinations of things on different note cards. My favorite one, I love the vagus. The vagus nerve is, the word Vegas is pronounced Vegas like Las Vegas, but it's Vegas like vagabond. And the word vagabond comes from this Latin word vagus that means wanderer. And it truly is the wanderer because it's the only one of the 12 cranial nerves that wanders outside of the head and neck region. It does have some sensory fibers for taste in the throat, but look at this. Muscles for swallowing, the muscles for vocal cords, a little bit of control of salivary glands, then fibers to the heart, fibers to the lungs, the liver, the stomach, the intestines. Everything else up here is all about your head and neck, except vagus, that will wander all the way down almost to your pelvic cavity. It's got extensions all the way to the deepest part of your abdomen and sends fibers to control most of the parasympathetic division of your thorax and abdomen. And 90% of your parasympathetic fibers that we'll talk about in a couple of weeks when we talk about autonomics, 90% of them come from your vagus nerve. So you'll hear me talking about my favorite cranial nerve again in 3 or 4 weeks when we talk about the autonomic nervous system. We're going to come back and talk about the vagus again. It's cranial nerve number 10. It also has the coolest Roman numeral too, the X. Accessory and hypoglossal are motor only, and the accessory controls I didn't mean to obliterate them. There we go. Sorry about that, guys. Accessory, cranial nerve number 11, motor only, to your sternocleidomastoid muscle on the front of your neck and the trapezius on the back of your neck. Remember, sternocleidomastoid helps to tilt your head down, kind of to flex the neck. Trapezius helps to extend the neck and look high up in the sky. The hypoglossal is cranial nerve number 12. Its name means under the tongue. The word glosso means tongue. So this one comes from under the tongue, and it's motor to all those muscles in the tongue. The tongue is mostly muscle, skeletal muscle, and it controls all the muscles within the tongue itself for tongue movement. Okay? So, any questions about the cranial nerves? You guys answer these questions if you have not done so already. I'm going to get some folks haven't done these questions in the top middle of page 165. Okay? Which cranial nerve does this? Which cranial nerve does that? Which nerves do this? Sometimes it's more than one. I want you guys to spend some time answering those. I know some of you have already. You're like, man, I've already put in the work. Not everybody has, but I want to address these next week after everybody's had a chance to look at these. Okay? And remember, your homework for brain is this weekend. You know, so you guys want to make sure that you have studied all of this stuff so that you can do the homework for brain. Any questions on the cranial nerves? Brain dead? Me too. Me too. We have time. I looked at our schedule a little while ago. Spinal cord is a relatively short chapter compared to brain. And so is the chapter after it, neural integration. And in fact, neural integration, which is chapter 15 in your lecture notes, actually overlaps with spinal cord a lot. And I usually cover a lot of it together, integrate it together. And your spinal cord quiz, homework quiz, is not until next week, or the week after, really, I think. So we can go ahead and call it early today and cover spinal cord and neural integration together next week. And we can easily cover it all in one day and probably even be finished a little bit early next week too. Because both of these next two chapters, chapter 13 and 15, are relatively short. And the main thing that I wanted to check, and I did, is that we have covered everything for the homework that is due this weekend. Nothing from spinal cord will be until the following week. And remember, another exciting thing is next week is our last class before spring break. Spring break comes real late in Gwinnett County. So Gwinnett Tech tries to go with the Gwinnett County schools. So we have class next Friday, but then we don't have class for 2 more weeks after that. So you'll have a lot of time to process all this information. So I am all for calling it a day a little bit early today if I have no major objections. And I'm sure that nobody would want to object to that. I'm sure that there's nobody in there kind of going, no, Nichols, please keep going. It's a lot. We covered a ton today. We covered a lot. No objections. What I'm saying is, I'm sure that there's nobody that is objecting that would actually speak up. There's probably some people out there that are kind of like, I could keep going. And I'm sitting there going, I don't know, man, this is exhausting for me every Friday. But I got it if you want to keep going. We can keep moving. We can call it. Let's call it. I like it. We're on a good schedule. We're on a good pace. The pace from here until exam 4, we're right on schedule. The schedule says we're supposed to cover spinal cord this week, but like I said, it's really short, and so is the one listed for next week, and we can pack both of those into 1 week and still even finish early next week. So I like it. I think that gives us a little bit better schedule. Hope you guys have a good weekend. Remember, you got to get to that brain homework before Saturday or Sunday. Saturday or Sunday. The A&P 2 stuff is always due on Sunday. The A&P 1 stuff is always Saturday. Oh, it's tomorrow at noon, the brain homework. Noon? I thought it was midnight. All right. Okay. Well, you guys get to it. Have a great weekend. Get that homework done if you haven't done it already. Enjoy your weekend. Get out and enjoy the weather. It's nice out there. That rain got the pollen out of the air. So enjoy some beautiful weather. Yeah, you guys have a great rest of your day. Great weekend. Keep studying. Keep up with this material. I want to balance all of this happy weekend stuff with I'm giving you some extra time to stay on task and get this studying done. But you guys have a great weekend and a great week, and I'll see you next Friday at 2:30. Take care.